Hello everyone, my name is Tsanko and I have explained in my first video in my YouTube channel. I am emergency medicine doctor and nutritionist, and I'm going to be posting some videos with regards to different kinds of emergency conditions that are created strongly and mainly towards the general public, so they have a general understanding of what kind of a job we do, the emergency doctors, when they can seek emergency doctors help, when they can go to emergency department, when it's appropriate to go and when it's not, when different conditions can be basically determined as and described as emergency conditions, and some other conditions that are described as primary conditions, so conditions that are mainly for the primary care rather than the actual emergency department. So in my first video I have decided to create a video which discuss the main reasons why a patient would need to go to emergency department. In the future I will be creating more videos that will be discussing conditions concerning mainly the general public, and I will be also creating videos that will be mainly towards healthcare professionals with some kind of medical degree that have a bit deeper understanding of the medicine. I will be discussing different guidelines, different protocols. Also, I will be sharing videos about nutrition, healthy food, healthy habits, different kind of programs and different kind of diets which can bring some more benefits to every single patient and to their background conditions. Also, I will be discussing different sports exercises, different kind of exercises that may help you stay fit. But anyway, this will come in the future. Let's start with our first session, which I am planning to make mainly towards the general public. As I said previously, these are the main conditions that can actually bring someone to the ER or to the accident and emergency department, as we call it in the United Kingdom. So, according to the Royal College of Emergency Medicine, the following are the main reasons, and the following several things that I'm going to list in a bit are the main reasons why people attend emergency departments nowadays. And obviously, if you or someone around you experience any of those signs or symptoms, they should seek help from emergency department as soon as possible. So the first condition that requires immediate attention from a specialist doctor in emergency medicine is bleeding, which is difficult to stop or doesn't stop at all. But any kind of bleeding, in the United Kingdom you need to call 999, in Europe 112, in the States 911, and basically anywhere else just the local emergency number. Bleeding that can't stop and that is not stopping, subsiding, is extremely dangerous because can lead to different conditions that are very, very, very serious conditions and are extremely life-threatening. So we should always stay very cautious about these things, and bleeding of any kind needs to be assessed as soon as possible, as well as treated by emergency physician. The second main reason why people are attending the emergency departments is different kind of breathing problems. So breathing difficulties of any kind, shortness of breath, cough, not on chest pain but chest tightness, which leads to deteriorated breathing. This needs to be assessed as well, because the breathing difficulties can actually be caused by some severe chest infection, or by severe pneumothorax, or by pulmonary embolism as well, which is a very, very serious condition. It needs to be treated in a timely manner. Most likely in the emergency department, the emergency physician will proceed with a chest x-ray, which will show us the condition of the lungs at the moment. But anyway, we will be providing the assessment in place, and we will be providing the further management. I'm saying we because I'm part of these people who are doing this. This is my specialty. So we will assess the lungs, we will listen to the chest, we will observe the patient, we will see what the basics of observations are, like respiratory rate, saturation, obviously heart rate, blood pressure as well, temperature, if there is any temperature, fever, which may be leading us that there may be some hidden chest infection, but the breathing symptoms, the breathing difficulties, and probably the chest tightness is actually the symptoms that start from the outset of when the actual infection presents in our body, and we start struggling with it. Our immune system starts fighting it. The third reason that people were attending emergency departments in the United Kingdom, according to the RCAM, College for Emergency Medicine, is a change in the mental state. Change in the mental state means unusual behavior, confusion, different kind of changes in the normal behavior that people have. Also, very difficult. People with change in the mental status are people who are very difficult to arouse as well. So this is third reason when people are attending emergency departments. And if you observe that you're having some changes in your mental status, or any of your relatives is having changes in their mental status, please seek medical help as soon as possible. So go to the nearest A&E, or just call your local emergency services, which in the United Kingdom is 999. The fourth reason for attendances in the modern A&E departments of the UK is chest pain. Chest pain is quite a tricky one. It could be due to so many reasons, like pulmonary embolism, heart attack, chest infection, even indigestion, costochondritis, which is basically a diagnosis of exclusion. So if we, the emergency clinicians, exclude all the life-threatening reasons causing chest pain, we can actually, especially if there is some tightness or actual tenderness and palpation over the chest wall, we can easily confirm or suspect the diagnosis of costochondritis. But in the meantime, all sorts of condition needs to be excluded. So normally in the modern A&Es, what we normally do in people with chest pain, especially with sudden onset, we always take some blood, so we follow the cardiac enzymes. In some occasions, depends on the type of the chest pain, if it is worsening on deep breath, palpation, movement, anything like this, and it's not radiating down to the arm, jaw, neck, we may be checking the D-dimer as well. We may be checking the inflammatory markers. We may proceed with some chest x-rays. We may proceed with ECG as well, which will give us the idea how the heart is doing on the first place. Obviously, the cardiac enzymes and the D-dimer will show us if there is any clot, any blockage in the arteries, which supply blood firstly to the heart and then to the lungs. After many other things like regular observations, medications giving regular pain relief, etc., we can basically determine what kind of chest pain is this after getting all the results as well, and we can proceed with the relevant treatment. Obviously, I'm not going to discuss every single condition at the moment, but I promise that I'll be preparing a video for every single possible cause of chest pain. So please, if you ever experience chest pain, go to your local emergency department. Go to your local emergency care facility. Go to your local urgent treatment center. Just bear in mind that most of the times the urgent treatment centers are very limited of service. Most of the times you will be able to get seen over there by and assessed by emergency doctor, but just bear in mind that these services, these centers are very limited, and you may end up delaying your treatment rather than commencing it in a timely manner. So please check where your emergency care facility is, and if it's in a normal location and you have the possibility to get a quickest possible routes, obviously not by yourself, with a relative or friend or someone nearby, don't wait too long. If for any reason you're obstructed and you can't attend your emergency department when you have a chest pain as soon as possible, please call your emergency services, local emergency services, which in the United Kingdom is 999. The fifth most common reason why people were attending emergency departments in the United Kingdom, according to the RCAM, is choking. So choking is a very serious condition. This can lead to significant complications. So if someone is choking, if you're not trained in first aid, do not try to do anything. If you're not trained, if you don't have a basic knowledge on the techniques how to save someone's life whilst choking, please do not do anything apart from calling 999 or 911 or 112, depending on where you live, but do not attempt to do anything else apart from the right proven techniques, which will be surely helping you to save the patient. Otherwise it can lead to deterioration and everything can go in a really bad way where you don't want to go and you don't want to end up there. So ring the emergency services. Most of the times the operators will be advising you on what to do, and they will be advising you in case the patient loses consciousness and falls on the floor, how to commence CPR, because most likely patient who is choking and suddenly losing consciousness most likely suffering cardiac arrest and will need immediate support. Obviously I will make a video in the future explaining how the choking can be saved in the basis of normal environment outside the hospital or outside the ambulance. There are specific techniques that can be applied that can help massively to improve the breathing of the patient, and obviously the choking factor actually can be removed from the body by these techniques. This doesn't include putting your fingers in the mouth of the patient or anything like this. No, this is dangerous. This can cause trismus, which means that the jaw, the mandible, the lower jaw becomes very stiff, and most of the times people who are trying to help this way actually end up seriously injured. So if you don't know the exact technique to help someone choking, please do not attempt anything. Call 999, 911, 112, or whatever your code is, your phone number is for the emergency services, and just follow their advices. The sixth most common reason for attendance in the A&E departments of the UK is coughing up blood or vomiting blood. The reasons for coughing up blood can be a lot, can be many reasons. Many conditions can cause this. we as emergency clinicians ask different questions, trying to determine what is the likelihood of every single diagnosis. But also vomiting blood is the same. We ask a lot of questions about abdominal pain, any changes in the bowel habits, any black stools in the past, anything like this. So we ask so many questions trying to determine which is the right diagnosis that we need to suspect and consider, and how to proceed with the further investigation. So if you ever have an episode when you're coughing up blood, which is called hemoptysis, or hematemesis, which is vomiting blood, please do not hesitate to contact your local A&E department as soon as possible. Another very common reason for attending emergency department in the United Kingdom is an episode of fainting or a loss of consciousness. If you experience a fainting episode, or for some reason loss of consciousness, for example after a head injury or after heavy alcohol intoxication and multiple injuries after falls, regardless if they're mechanical or non-mechanical falls, please do not hesitate to call 999 in the United Kingdom or go to your local emergency department. You need to be assessed. Fainting could be due to numerous reasons. One of them, unfortunately, is a heart condition which changes the rhythm of the heart, how the heart actually works, and this in the future can be serious. In the future can cause loads of problems in your body, and unfortunately it also leads to death. So if you ever experience episodes of fainting or sudden onset of loss of consciousness without any explanation, please seek urgent help. Also, I would like to mention that seizures in epileptic patients are quite common as well in the United Kingdom, but this is basically a subcategory of the fainting / loss of consciousness category of our video. So I will be mentioning epilepsy. I will be discussing a lot about epilepsy in my videos, about techniques, about how to place a patient in recovery position when they faint. But this all obviously needs to be considered as an emergency condition. So if you observe someone on the floor with loss of consciousness, not just sleeping in the sofa or just decided to sleep on the ground outside on the street, please call obviously the local emergency services number, because this patient may be dying at that time and you may end up as his or her lifesaver. Another very common reason for attending A&E departments in the United Kingdom is suicidal thoughts, and or murder. So self-harming, suicidal thoughts, harming others is a very, very common reason for attendance. This needs to be assessed urgently. There are specially designed mental health teams that work in the, well, they don't work exactly in the A&E departments, but most of the times they're very close to the A&E departments and they can provide urgent assessment. For example, I work as an emergency clinician in Greater Manchester area, and there are quite a few hospitals around here that have their own mental health team inside the accident and emergency department, and they can provide an assessment almost immediately. Obviously this needs to be assessed by a trained specialist in the mental health, and further management should be decided. But if you or someone else experience any of those thoughts or wishes to harm people, to self-harm, to proceed with self-harm, or if you or any of your relatives, friends or anything like this have suicidal thoughts, please do not hesitate to call an ambulance or to go to the local A&E department. Especially call an ambulance if there are any signs of injuries like cuttings, bruises, different kind of attempts that can be described. So please do not hesitate to seek help in A&E department, accident and emergency department. Another reason, very common reason, unfortunately, for seeking medical help in emergency department is a head injury plus or minus spinal injury. Unfortunately, many elderly people who are frail, difficult to mobilize, often trip or slip by accident, so mechanical type of falls, and bang their heads. They need to be assessed. Their spine needs to be assessed properly. So if you experience any of those, or for any reason, or if you are assaulted outside on the street, or if you fall, or if something falls and hits you to the head, and you have any of those symptoms like and signs like loss of consciousness, vomiting, seizures, if you can't actually remember what happened, was it that you fell or something like this, and you're quite unsure and uncertain of the circumstances of the injury to the head, please do not hesitate to seek emergency help, especially with the history of being unable to recall the events, seizures, anything like this, post-head injury confusion, severe headache. Please do not hesitate to contact A&E and to get seen in these quite severe cases, as the spinal fractures and the head injuries are of a significant risk for so many complications, so many deteriorations in the future, that, trust me, I have seen so many patients with head injuries and spinal injuries in the past that it's way better if we get it on time and treat it on time, for yourself, for your relatives, for everybody. It's better. So do not hesitate to keep in touch with us and to seek our help. Obviously, if the patient is unconscious, deteriorating with rapid breathing, not responding, call 999 or 911 or 112 or the local number providing emergency services immediately. If you have any concerns about transporting this patient or transporting yourself, well, obviously do not transport yourself after a head injury with your own car or your vehicle. You shouldn't be driving in this case. Just call the ambulance services, just call the emergency services, they will assist you. And basically that's it with regards to the head injuries and spinal injuries. Just be very cautious and always seek medical help in emergency department when there are any of those head injuries, spinal injuries, regardless the severity. They need to be assessed. Another very common reason, unfortunately, for attendance in emergency department is severe or persistent vomiting. The vomiting itself can be quite distressing, leading to dehydration, feeling malaise, feeling awful, horrible, chest tightness, abdominal pain as well, abdominal pain, I mean, especially here in the epigastric area and the upper levels of the stomach. So in these situations, especially if the vomiting is difficult to control, you're not able to tolerate any fluids down, especially if you have a acute sudden onset of abdominal pain with bloating, please do not hesitate in any possible way to seek emergency, but very emergency medical help. Call the ambulance services, go to A&E, get seen. This needs to be cleared out as soon as possible. Another common reason for attending emergency departments is the sudden injury due to different kind of unfortunate events that may happen, like road traffic collisions, falls, mechanicals, burns or smoke, different kind of lacerations, self-harms, false deep lacerations that you can see your bones or tissues or muscle underneath with active bleeding. Please do not hesitate. Go to A&E, call an ambulance, ask someone to drive you if you live nearby, but do not delay the attendance. You need to be seen. Another reason, very common reason actually, for people to attend emergency departments, and I actually encourage this behavior in these people, is if they experience anything that is not usual for them, like well, not usual, but I mean mainly pain in this situation. So any kind of sudden onset of pain anywhere in the body, the pain means that something is wrong and needs to be assessed. So if you experience any kind of pain that is not normal for you, you need to be seen, especially if it's a sudden onset of pain in the limb. This can be occlusion in blood arteries or veins with swelling, etc., with change in the color. This needs to be seen as soon as possible. This is a life-threatening condition. I will be, obviously, as I said previously, I will be doing videos about most of these conditions that actually for all of them, and even more about these conditions. I will be explaining different examples, what could be the reason, what could be done, why, where, how. So just bear in mind from this video, if you learn anything from this video, please, if you have any of those conditions that I have mentioned already, please seek help in emergency department as soon as possible. Do not try to drive yourself. Do not try to go there on your own. Ask a relative to help you. Ask a neighbor. Ask a friend. Call the local emergency services. Someone will assist you, but do not risk your life and the life of others by driving, especially with serious vomiting or head injury or anything like this. Choking, with change in the mental state. Do not risk to drive. You are not safe for yourself, for your family, for your friends, for other people in the community. Another very common reason for attendance in A&E is dizziness with sudden onset, weakness, generalized weakness, or weakness in a side of the body or in specific limb, or change in the vision. This needs to be assessed as soon as possible as well. This may be hiding signs of a stroke or actual signs of a stroke. So we need to see as soon as possible. We need to do some blood tests. We may need to do some CT scans, MRI scans, depending on the severity of the situation. So it's always a clinician's decision, of course, when you go there and you get seen and assessed by the doctor. We obviously provide different kind of assessments. We test different things in the meantime. But yeah, that's the main thing. You need to be seen. If you have any of those symptoms, you need to go to your local hospital, where the hospital provides emergency medical service, or call 999. Obviously, in these situations, if you are not able to go there in the next couple to a few minutes on your own, or with not on your own, but with relative, friend, neighbor, etc., person from the community, just to go with you to the department. If you're unable to get anyone to support you, please do not attempt to go on your own. Call an ambulance, especially with those symptoms. These symptoms are red flag, and you will be definitely categorized in a higher priority. So do not worry, the ambulance services are brilliant. I have observed the work of ambulance services in several countries. I used to work myself in the National Center for Accident and Emergency Medicine in Sofia, Bulgaria, which is ambulance service with both paramedics, nurses, doctors. I used to be a trauma doctor over there, and I used to see so many conditions, so many patients, and I know that these kind of things are categorized quickly in a higher priority, which means that the ambulance crew will arrive quicker than someone with sore throat, for example, or anything else. I'm not saying sore throat is not a symptom to be concerned about, but if the sore throat is mild, you don't have any breathing difficulties, obviously this could wait a little bit in the time to see if this is just a simple viral infection, and if it will go away with simple analgesia, fluids, vitamins, or if it could be some medical emergency, but obviously you'll know by that time. And I will be doing a video specifically about the sore throat, because a sore throat could be a condition that needs to be seen in the primary care, but also the sore throat can be leading to a condition that needs to be treated as a medical ENT emergency. Another very common reason for presentation in the emergency department is intoxication, with poisonous substances, alcohol, anything like this. This is common. If you observe someone with alcohol intoxication, or if you suspect someone is intoxicated or with some mixed overdose for whatever reason, if it's a self-harm or if it is accidental overdose or just severe alcohol intoxication or any kind of intoxication and ingestion of any kind of poisonous substance, it's a must go to emergency department as soon as possible. Severe abdominal pain is probably the last but definitely not the least reason for emergency department attendance. It is one of the most common symptoms why and reasons actually why young female patients attend the emergency department. Most of the times we need to exclude ladies in a childbearing age. We need to exclude pregnancy for this reason, for this pain, and some blood tests as well. Physical examination are very important, as well as urine dipstick to determine if there's some hidden urinary tract infection. Abdominal pain, especially in people over the age of 60-65, is a red flag, needs to be assessed as soon as possible. So do not hesitate to liaise with local emergency departments. If you have any of these symptoms and if you're in this age that you can't go there on your own, please call your relatives, your kids, your friends, your neighbors. Just get someone walking on the street outside and tell them, look, the hospital is 1 or 2 minutes away, can you please give me a lift to the A&E? I have some abdominal pain which is deteriorating. But if you feel that you should wait for an ambulance, then do so. Call an ambulance and wait for it. Trust me, it will be way better. Thank you very much for your time, guys. I really enjoyed this video. Please subscribe to my channel, hit the thumbs up button. I will be doing more videos like this. I'll be giving practical advices to people from the general public, how to act in different cases, in different situations. We need to be very, very specific in this. We need to educate people, and I'm absolutely happy that I can provide this service to you. I can provide these videos, I can share my knowledge with yourself, and I can actually make your life better by this, improve your knowledge, your self-awareness about these conditions, and how you can help yourself or someone else in an episode of, as I said previously, in changing the mental status, breathing difficulties, chest pain, choking, especially young children. I will be doing videos about all these fainting, loss of consciousness episodes, head injuries. So I will be showing examples as well. I will be explaining about different reasons, as I said previously, about the whole body pains, chest pains, back pains, etc. that can be causing to these symptoms. So we will discuss this further in the topics. Sometimes I will be uploading videos as well which are directly towards the doctor's team, so not only doctors, obviously, only healthcare professionals, also medical students. The medical students can benefit from videos like this, because this will give the opportunity to quickly refresh their knowledge and get the modern guidelines about specific treatments. For example, if I discuss a case about acute coronary syndrome in a professional video, in the professional playlist, I will be discussing the modern treatments, the modern guidelines, the modern understandings. I will be also thinking also about doing some interviews with other clinicians who can share their experience, their knowledge, and we can do it like a live video, like a job interview, by sharing my screen or doing it live. We don't know yet. I will do it definitely, but I don't have a clear plan at this time how I will do it. Is it going to be, because the COVID-19 pandemic obviously is still kicking, and we should consider our safety and everyone's safety. So most likely the personal meeting with other doctors and interviewing them will be left and postponed for a little bit later in the future. But I am planning to do the same thing by sharing my screen and doing, for example, any kind of communication with these doctors on Facebook, Messenger, or WhatsApp or anything like this, that we can share screens and we can have videos and we can ask questions and discuss different things. Alright, thank you very much. I really appreciate your time. Please subscribe to my channel, hit a thumbs up and enjoy the video. Bye bye.